عليكم ورحمة الله وبركاته يا دكاترة. للناس بس اللي بتسأل، اللي احنا حتى الآن لسه ما بدأناش.
احنا هنبتدي حالا دلوقتي يا أستاذ عبد الله.
اتفضل يا دكتور.
بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. كل سنة وانتم طيبين، وإن شاء الله تكون
Recording in progress.
عيد سعيد ورمضان كريم وكل المناسبات الطيبة. وهنبتدي نعمل المراجعة بتاعة اليورينري موديول. وزي ما احنا اتعودنا في الموديولات السابقة بنعرض بعض الحالات وبننتظر الإجابات بتاعت حضراتكم عليها على الشات، وبعدين نعمل الدسكشن المطلوب. الحالة الأولانية عبارة عن اكس راي للبلفس و سي تي للبلفس برضو. ايه الأخبار؟ ممتاز. حد قال إن this is an ectopic pelvic kidney وفيها stones، وهي إجابة صحيحة. This is the kidney which is located in the pelvis، وباين في البلين اكس راي الستونز، وبان طبعا في السي تي نفس الحكاية. المشكلة في الإكتوبيك بلفيك كيدني إن هي دايما بتبقى مس انتربريتد على إن هي حاجة تانية، وفي الغالب لو كان المريض واحدة ست فبيعتقدوا إن دي النكسال ماس أو حاجة زي كده. ولكن دايما we take into consideration the possibility إن الكدني ممكن تكون موجودة في البلفس، ويكون فيها معظم المشاكل اللي بتحصل في الكدني لو كانت في مكانها. الحالة اللي بعد كده coronal CT scan of the abdomen، الإجابة angiomyolipoma، and this is right. This is a fat containing lesion in the left kidney. The most common fat containing lesion in the kidney is angiomyolipoma. معظم الحاجات التانية اللي هي containing fat are considered rare بالنسبة للانجيومايليبوما. السؤال اللي بعد كده ده هو male patient 27 years old presented by immediate onset of lower abdominal pain after blunt trauma to the lower abdomen by heavy machinery trailer pinning him against a large truck for several seconds. And this is the post-contrast scans of the abdomen. Yes, this is renal lacerations of an ectopic kidney also. This kidney is not located at its usual site. It is seen in the pelvis, and it is traumatized with renal laceration and perinephric hematoma. The answer is right. This is a renal cyst, and we assume that you know which Bosniak category of this cyst. Bosniak 2F. Now, yes, this is Bosniak 2, and category 2, where the renal cyst contains very fine septations without calcium or mural nodules. If the septations are too much, then you consider it category 2F, but in such a case, this is category 2. Next case is a CT scan of the pelvis of a patient with follow-up over, let us say, 2 years, where you can see this lesion in the pelvis, and this is diverticular carcinoma, or bladder cancer in a diverticulum. You see, this is a renal bladder diverticulum, and it has a very small, minute nodule at 2018. And after, let us say, about 2 years or so, the nodule has grown and it formed a mass, and this mass started to infiltrate the adjacent structures in the pelvis, and this is diagnostic of bladder cancer in a diverticulum or the urethral tumor. Next case is a CT scan, the coronal images of the abdomen. Hydatid cyst, TB, renal TB, urethral tumor. Yes, the answer is urethral tumor with liver metastasis. If you look carefully here and you see there is an enhancing lesion affecting the proximal part of the ureter on the right side, and there are multiple focal hepatic lesions representing a metastatic deposit. This is ureteric transitional cell carcinoma with metastasis in the liver. Next case is a section of the abdomen post-contrast study. Yes, and this is a renal abscess, but this is not the only renal abscess. مش هو الحاجة الوحيدة اللي موجودة، ولكن مع حاجات تانية. ماشي. Yes, granulomatous pyelonephritis, and this is the kidney, which is totally replaced, almost totally replaced by fat, and there is a big stone within the kidney, and there is a multilocular abscess cavity which is seen in the posterior perinephric space. Then the right answer would be the xanthogranulomatous pyelonephritis with perinephric abscess. يعني عاوز أقول إن المنظر دوت is very classic for perinephric abscess with marginal enhancement and the stranding of the surrounding fat. Next case is a CT scan of the abdomen of a female patient, 53 years old, and you can see a big mass. Yes, and this is lymphoma, very good. Lymphoma affecting the kidney as well as the para-aortic lymph nodes. Frequently, the lymphoma of the para-aortic lymph nodes can invade the kidney, and less frequently, lymphoma of the kidney originating in the kidney may be associated by or with para-aortic lymph nodes. مهما كانت الإجابة، ولكن you are dealing with retroperitoneal lymphoma affecting the para-aortic nodes as well as the left kidney. Next case is a female 72 years old, and this is the enhanced CT scan of the abdomen. Then yes, and the answer is emphysematous pyelonephritis. You got air in the collecting system of the right kidney, which is relatively swollen with a stranding of the perinephric fat. Also, there is a stranding of the perinephric fat on the left side, but the kidney is good. The abnormality is on the right side, and this is emphysematous bilitis, meaning that air is located in the collecting system. Pyelonephritis, meaning that air is present in the collecting system as well as in the renal parenchyma. Next case is a male patient, 48 years old, and there is a section in the abdomen and another section in the pelvis. Yes, urinary bladder cancer. Okay, yes. This is circumferential non-uniform mural thickness thickening of the urine bladder, a diagnostic of transitional cell carcinoma of the bladder that has invaded the ureteric orifices with consequent bilateral back pressure changes on the kidneys. Then the answer is transitional cell carcinoma with bilateral hydroureteronephrosis. Next case is an MR urography of a child 3 years old. ميجا يوريتر. والصوت بيقطع بس مش من عندي أنا، ممكن يكون من النت اللي هي اللي عندكم. حد قال فيزايكو يوريتريك ريفلكس، وحد قال posterior cerebral valve، وحد قال diverticulosis of the urinary bladder. لكن الإجابة الصحيحة إن this is an ectopic kidney وفيها pelvic junction obstruction. الكدني is located lower down in the reaching the pelvis, of course, and there is distension of the renal pelvis as well as the chelicles. This is the renal bladder. Then the diagnosis is pelvic junction obstruction of an ectopic kidney. Next case is a film obtained from ascending cystouroscopy. Yes, of course, this is zygoreteric reflux, but what else? Cross diffused ectopia, double collecting. Yes, this is right. Double collecting system with reflux, and yeah, the left kidney is at its location, but here you can see two moieties. The upper moiety is okay and the ureter is good, but the lower moiety is markedly dilated with distension and the dilatation of the ureter, which is tortuous, and this is the lower moiety usually suffers from abnormalities, especially the vesicular reflux. And here you got vesicular reflux and hydronephrosis of the lower moiety. Next case is a retrograde bilography through ureteric catheters, and the patient had recurrent acute urinary tract infection since the age of 7. She is now 25. Then I cannot detect the left kidney in the previous case. Okay, let us go to the previous case. I assume that this is the shadow of the left kidney, but you know, across the ectopic kidney is usually fused to the lower ball of the kidney اللي هي موجودة في المكان بتاعها. And this is duplex kidney with reflux. Next is the case on and what normal not to see the left kidney. Yes, if there is no reflux on the left side, you may not see the kidney. Then medial deviation of the right ureter. Urethrocoel, no, there is no urethrocoel. There are ureteric catheters. Retrocaval ureter, no. You see the bizarre appearance of the collecting system on both sides, and this means that this kidney is inflamed and chronically inflamed, let us say, with distortion of the pelvic ileal system on both sides, which is highly suggestive of chronic pyelonephritic kidney. In order to diagnose TB, you should see some calcifications to help to reach the diagnosis. Where is the urinary bladder? Here is the urinary bladder. Yes, and the first film contrast was injected through the ureteric stent, and later on the urinary bladder is filled with contrast. This is not papillary necrosis because you do not see some contrast material which is going inside the renal pyramids. Then this is chronic pyelonephritis. Next case is CT scans of the pelvis, of the abdomen, showing a lesion in the in the right kidney. Why not retro? Yes, renal cell carcinoma, transitional cell carcinoma. Okay, and yeah, you see here that there is an ill-defined mass in the kidney which has extended into the perinephric space and also has extended into the retroperitoneum. And in this case, you can see one of the signs that can help in the diagnosis, where you can see the vessels are floating in the retroperitoneal mass. You see the left renal vein, the IVC, the right renal vein, and the right renal artery. They are not compressed and not displaced, but they are floating inside the mass. And this will help you to reach the diagnosis of lymphoma, which is the right answer for this case. Yes, lymphoma is the right answer. And this is the next case, IVB, of a female patient, 59 years old, with hematuria. Yes, transitional cell carcinoma. Okay, this is right. You got an irregular shaped filling defect in the renal pelvis with some distension of the calyces, and this is diagnostic. The most common filling defect in the renal pelvis is transitional cell carcinoma. Next case is two sections in the pelvis with contrast. Yes, very good. This is not urethral cyst, but urethral cancer, or what we call the adenocarcinoma of the urinary bladder. And this arises from the urachus, which connects the anterior part of the urinary bladder to the umbilicus. Then whenever you see a mass in the urinary bladder, you consider it transitional cell carcinoma. But if the mass arises from the anterior wall of the bladder and extends outside the bladder more than extending inside the bladder, then you consider the possibility of urethral adenocarcinoma. Next case is selected images from the pelvic scans with coronal and sagittal reconstructed images. Urinary bladder hernia is not hernia only, herniated urinary bladder. Yes, the bladder has herniated into an inguinal hernia, and the herniated part of the bladder contains a soft tissue mass. And the mass in the bladder سواء كانت البلادر في مكانها أو herniated دوت معناها إن في carcinoma, and this is bladder cancer in a herniated bladder through the inguinal hernia. Yes. Next case is an ultrasound and the Doppler of the testis of a 28 years old man with a slowly growing non-tender mass of the right testicle. Epidermoid, yes, the answer is good. This is a classic appearance of the epidermoid cyst, which is a banded mass in the testis showing the whorly appearance or the onion peel appearance without any internal vascularity. This is classic appearance of testicular epidermoid. Next case is an axial section and the coronal one of a 50 years old male with new onset of left flank pain and hematuria. This is right, not left. Right flank pain and hematuria. Yes, and this is a cystic renal cell carcinoma. You got a cystic lesion with internal soft tissue component or mural nodules, diagnostic of cystic renal cell carcinoma. Next case is testicular or scrotal ultrasound and Doppler of a 48 years old male with right testicular pain and swelling. Yes, yes, the answer is very good, and this is epididymitis, and you got a swelling of the epididymis with marked increased vascularity on Doppler imaging, diagnostic of epididymitis. The testicle is not affected. Next case is an axial T2 weighted image of the pelvis. Seminal vesicle stone. Yes, the answer is good. Seminal vesicle stone. You see, the seminal vesicles are cystic actually, and you got two big cystic lesions in the seminal vesicles. On the right side, you got minute calculi within the right seminal vesicle, and these are seminal vesicle calculi. Ultrasound of the testis. Yes, microlithiasis, very good. This is testicular microlithiasis, multiple echogenic foci scattered throughout the testicle. Yeah, this is a selected film from, I think this is ascending cystouroscopy and reflux grade 5. Mega, yes, mega ureter, very good. This is congenital mega ureter because if this is reflux bilateral, you cannot assume that this ureter is hugely dilated while this one is a little bit dilated. This is congenital mega cysts, mega ureter. Next case is two sections from an abdominal CT at the level of the kidneys. Right, hydronephrosis, yes, and then this is a hydronephrotic kidney, of course, and you cannot see the ureter to say that this is congenital pelvic junction obstruction. Or what you can say that the renal pelvis and calyces are dilated with relative thinning of the renal parenchyma. This case is provided علشان نفرق ما بين حاجة اسمها the rim sign وحاجة اسمها rim like pattern. الكدني لما بتبقى obstructed لفترة طويلة بيحصل فيها loss of volume اللي احنا بنسميه post obstructive atrophy، وبيكون الرينال بلفس والكليسيس دايليتد، وبيكون الرينال بارينكيما رفيعة جدا زي ما احنا شايفين. دوت لازم يتفرق من حاجة اسمها the cortical rim sign. الكورتيكال ريم ساين معناها ان في الحرف بتاع الكدني اللي هو الخط الرفيع جدا اللي على الكورتكس واخد صبغة، في حين ان الكورتكس نفسها مش واخدة صبغة. واحنا عارفين ان لما بنحقن صبغة الكورتكس الاول بتاخد صبغة وبعدين تنزل في البلفيك كيليسيال سيستم. فلما تكون الكورتكس مش واخدة صبغة معناها انها اسكيميك، والاسكيميك كورتكس ديت بتبقى موجودة في major renal vascular compromise، زي ما يكون في renal artery obstruction أو renal vein thrombosis أو acute tubular necrosis أو acute cortical necrosis. الحاجات دهيت بتعمل ischemic changes in the renal cortex، وبتخلي في الحرف الأخير من الكدني اللي هو آخر حتة في الكدني بتبقى واخدة صبغة، لأن ديت الواخد صبغة ده is supplied by perforating branches ملهمش دعوة بالرينال ارتري خالص. وعشان كده لما بنبص على مريض زي دوت كده عندها 34 سنة وجالها يوتراين اتوني وهي بتولد في السيزيريان سيكشن، فحصل لها uncontrollable bleeding and hemorrhagic shock with 2 episodes of cardiac arrest and multi-organ failure with disseminated intravascular coagulation. then الهيستوري ده كله على بعضيه بيقول ان الكدني حصل فيها major drop of the blood supply، وعشان كده حصل المنظر اللي احنا شايفينه دوت اللي هو بيتشخص اسمه acute renal cortical necrosis. Acute, this is not an infarction, but there is necrosis of the renal cortex in particular due to major interruption of the blood supply to the kidney. then you got الحرف الأخير بتاع الكدني واخد صبغة لأن دوت واخد من الكابسولار vessels، وده اللي هما بيسموها the cortical rim sign. And if you see the cortical rim sign and the cortex itself is not enhancing but the medulla is enhancing, this is diagnostic of acute renal cortical necrosis. And this is an appearance نفس الحكاية acute renal cortical necrosis, and it may cause acute renal failure manifest by severe prolonged shock زي ما كان في الحالة اللي قبل كده. غالبا المشكلة بتكون bilateral لأن السبب بيكون systemic، ولما بيحصل damage للجلوميرولاي واسكيميك changes of the cortex بتدينا نفس المنظر ده. والآخر آخر rim of the cortex is intact and the patient presents by severe oliguria or anuria. Then this disease is irreversible, and the damage of the kidney is not reversed once more, and as you can see it's bilateral. If you have ultrasound of the kidney, you can see that there is loss of corticomedullary differentiation. This is the normal kidney where you can see the cortex and the medulla, and this is the kidney with acute cortical necrosis with loss of differentiation between the cortex and the medulla. A thin millimetric rim of subcapsular cortical enhancement اللي هو اسمه the rim sign. This is known as the cortical rim sign with because of the maintenance of the blood supply to the cortex from the capsular vessels. Renal failure due to acute cortical necrosis is irreversible, and there is no specific treatment for such a condition. Next case, you can see here a CT scan of the abdomen at the level of the kidneys. Yes, and the answer is good. This is renal abscess. الحقيقة أنا يعني مبسوط جدا إن أنتوا يعني بتعرفوا تفرقوا الحاجات الانفلاماتوري من الحاجات النيوبلاستيك، لأن أنا من يومين بس شفت حالة رينال أبسس وكانت متشخصة رينال سيل كارسينوما، والمريض كان زباوت إن هو يعمل نفريكتومي وكده. ولكن يعني قلت لهم حطوا إبرة في الخراج هيطلع صديده يعني. المهم الأمور مشيت كويس. الحكاية ديت مهمة جدا يا جماعة، لأن الديفرنشيشن ما بين benign و malignant lesion is mandatory. تعالى للحالة اللي زي كده. And this is an enhancing scan at the level of the kidney showing right renal mass. Yes, and this is oncocytoma. Very good. This mass is classic for oncocytoma because of the smooth edge and the central scar. But if the mass is not classic for oncocytoma, this mass should be considered as renal cell carcinoma, and many times it should be biopsied. Next case is an enhanced scan of the abdomen at the level of the kidneys. Acute, yes, lymphoma is the right answer. Both kidneys are infiltrated by soft tissue masses. There is no enhancement of the renal parenchyma, and there is no excretion in the collecting system. And this is bilateral, totally infiltrated kidneys by soft tissue masses, and impressive of lymphoma. This patient had a history of bronchogenic carcinoma, and there are 3 findings in these images. Yes, Mets, renal metastasis, this is one of the findings. Para-aortic lymph nodes, a second finding, remaining 1. باقي واحدة. Yes. عندنا metastasis في البوست كيدنيز، وعندنا lymph node metastasis، باقي واحدة. مفيش vertebral metastasis، مفيش IVC thrombosis. هو الأورطة الحقيقة، إن جيت للجد يعني، هو الأورطة هو اللي مقفول. هنا هو this is the aorta، وفي المنطقة ديت you cannot see enhancement of the aorta. It is obliterated, and this is Lurich syndrome, occlusion of the aorta at the level of the infrarenal vessels, then multiple bilateral metastatic deposits in the kidneys, retroperitoneal lymphadenopathy, and aortic occlusion. Next case is a patient with uterine leiomyosarcoma, and she had a hysterectomy 10 years ago, and these are the scans of her abdomen. Yes, liver and right kidney metastatic deposits. The answer is right. There is a mass in the kidney and focal lesions in the liver. Both are diagnostic of metastasis from uterine sarcoma. Elevated BSA after prostatic biopsy. Benign hyperprostatic hemorrhage. Yes, hemorrhage is right. Post biopsy hemorrhage, which is bright in the T1 and bright in the T2. خلي بالك ان الهemorrhage بيعمل variable behaviors في diffusion weighted images. يعني ممكن يعمل diffusion restriction وممكن ما يعملش. And this is post biopsy hemorrhage in the prostatic gland. Ultrasound of the testis. Yes, epididymal cyst أو spermatocele. The same. This is epididymal cyst, simple cyst with acoustic enhancement. Next case, ultrasound of the scrotum. No, this is not microlithiasis. This is not the testis. This is not the testis. The testis is here. بايوسيل. بايوسيل قصدك يعني طيب اوكي. This is a chronically infected scrotum. The hydrocele is infected, and because of its chronicity, it contains debris and some cholesterol particles which are seen like this. This is known as chronic hydrocele. ان chronic hydrocele ما بيكونش طبعا في history of trauma عشان ما يبقاش هيماتوسيل، وبيبقى الفلويد عنده speckled internal echogenic debris اللي احنا شايفينها ديت، بيكمبرس التستس على ناحية، وكمان بينزل فيها كوليسترول كريستالز. This is chronic hydrocele. elevated BSA 56 سنة. بروستاتيك كانسر شمال ولا يمين؟ left. Yes, this is left prostatic cancer. You see a nodule in the peripheral zone with diffusion restriction. أبيض في diffusion وأسود في ADC. Diagnostic of prostatic cancer. Next case 45 سنة with severe right flank pain and back pain. Ruptured angiomyolipoma, bleeding angiomyolipoma, right answer. And this is the mass containing fat in the right kidney with perinephric collection representing blood. And you know that angiomyolipoma frequently it may bleed, and اللي بيقول لك ان دي انجيومايلوبوما هو الفات اللي موجود جواها، واللي بيقول لك ان هي نزفت هو الهيماتوما اللي موجوده حوالين الكدني. Next case polycystic. Yes, this is polycystic kidneys. What about the liver? What about these shadows? Yeah, okay. And the polycystic kidney, you may see cysts in the liver. This is one of the constant findings, but sometimes also you can see cysts in the seminal vesicles, and this is the case. With polycystic kidney, you can got cystic lesions in the seminal vesicles. هذا وبالله التوفيق. شكرا جزيلا لحضراتكم.